Welcome, everyone. We'll get started in a few minutes. We'll get started about 6:05. Until everyone joins, we would like to start off with the question of the day, and it is what is your favorite sport? So feel free to answer that in the chat or say anything. Hi, everyone. Thank you for joining us. We'll get started in just a minute.
All right, everybody. Welcome, Alliance HOSA members, to our January guest speaker event. Good evening. I am Mansa Prasad. And just to introduce myself, I am the Secretary of Alliance HOSA, and I am so excited to be here tonight with all of you to learn more about an incredible profession.
I'm Aditi, part of the Sophomore Council, and I'm so eager to get started.
So tonight's guest speaker is Ms. Turner, an athletic trainer, and on behalf of Alliance HOSA, we welcome you with nothing but open arms.
Thank you, guys. I'm so glad to be here.
Ms. Turner, thank you. Ms. Turner, if you could say a few words about yourself and your profession to our audience.
Perfect. So my name is Sydney. I work at North Forsyth High School. I'm one of the athletic trainers there. There's two of us. So athletic trainers, like just a description, kind of a summary. We're qualified, multi-skilled healthcare professionals who render services and treatments under the direction of a physician that has to do with our education and training and kind of what the state statutes allows us to do. We're part of like a bigger healthcare team, including physicians, physician's assistants, chiropractors, mental health professionals, stuff like that. We're part of that whole team. And we can provide, we can help with injury and illness prevention, primary care, wellness promotion, and education, emergent care, so like right at the time they get injured, examination and clinical diagnosis, therapeutic intervention and rehab of injuries, and then all sorts of general medical conditions. And then we're not just in athletics, we also are in multiple settings. So we're in the clinic, we're in the military setting, we're in the industrial setting, we're in performing arts setting. So even though our title is athletic trainer, that doesn't mean we just work totally with high school, professional, or college athletics.
Awesome. I mean, again, like we said, we are so honored to have you, and we're so excited to have you here with us. I think it's best to kind of backtrack and start from the beginning of it all. So as you may know, most of the students that are here with us tonight are mainly high schoolers or middle schoolers. So let's start from there. Did you decide on sports medicine in your high school career? What was the high school journey like, Ms. Turner?
Okay, so I was an athlete growing up. I played softball in high school, played softball in college, so I knew I wanted to stay with athletics. I love that population. So I didn't really exactly know what an athletic trainer was in high school. And it's awesome that you guys have these speakers come in. But I knew I wanted to be with athletics, and I knew I wanted to be in some kind of science, medical field. So when I was looking around at different colleges and different majors and kind of when I wanted to start off in, athletic training came up. And I was like, this is perfect. Like, this sounds like a good combination of both of the things I'm interested in.
Yeah, that's like really important because I think a lot of people, once they get to college or like their job, they put their passion like behind. But it's really cool how you combine like two of your passions and like what your job is now. So going a little bit into the future, how was college like you? What did you major in? What did you like? What were your extracurriculars? Kind of like that.
So I went to Limestone College. It's in a small town in Gaffney, South Carolina. My main reason I went there was athletic. They let me be an athlete and do athletic training, which is not commonly done just because the amount of clinical hours that go into becoming an athletic trainer. So I majored I have a bachelor's of science in athletic training. And then I had softball, like my other thing besides athletic training was softball. So I typically did practices after that. So I'd go to my practice and then I would head out to somebody else's practice, depending on what team or what athletic trainer I was following that semester.
Now, did you know sports medicine was the thing for you since you were in high school?
I didn't. So I went in so you can like pre-declare what major you want. So I was like, I'm going to do athletic training. And thankfully, like before you get into an athletic training program, they usually have like a athletic training 101, like a foundations of athletic training program. And this is typically like a big group of people. So like trying to figure out if athletic training is right for you, you do like a short amount of clinical hours. You go through like emergency care. So like CPR and taking blood pressure and kind of stuff like that. And then it's kind of like the feel out class. Like, is this something you're going to enjoy doing these hours, hanging out with these type of people, or is it really not for you and you can change your major that coming up semester? So that class was awesome. I loved it. And so the end of my first semester of my freshman year, we had, you have to interview to get into the athletic training program. So we did our interviews. And so about 60 people started out in my big class lab. And then they only accept 15. So it cut down really fast. And I bet only like 20 really interviewed to be in the program. So that was kind of the way I was like, this is going to be for me. I was so glad they had that 101 foundations class.
Yeah, going along with your 101 foundations class, were you like mentored by someone in college?
So we had 3 athletic training teachers, and like the head of the program was my advisor, my college advisor. So she was one of the main mentors that I kept throughout my 4 years at Limestone. She was amazing. And then Limestone, where I went, is big athletic school. So we had 7 athletic trainers on staff. So we got to do a rotation with each one of those. And throughout that time, some you get close to, some you don't, just depending on personalities. And I had a really good mentor. I still remember things when I'm doing evals or treatment or something like that. I remember things she said to me, and that's kind of how I based my stuff off of. She's one of the main people who taught me how to tape an ankle. So definitely you have main mentors, and then you have some, you learn pieces from every clinical clinician along the way.
Do you have any sort of recommendations for high schoolers who want to pursue sports medicine in the future?
So as of now, athletic training, sports medicine has actually changed a little bit since I graduated, and I just graduated in 2018, so it hasn't been a while. They actually had just moved. So I graduated with a bachelor's degree, and now you cannot graduate with a bachelor's degree. They moved to a master's degree. So my recommendation would be, make sure if you want to do athletic training and you're like, I'm pretty sure I want to do it. If you go to a big colleges, they have like sports med interns that you can either work with a football team or basketball, usually the big sports that need them. I would say get into something like that. See if you can intern with those or just volunteer. And make sure you take the right prereqs to get into the master's program once you graduate with your undergrad degree. So usually like a kinesiology degree, exercise science degree, strength and conditioning degree, something like that will typically have the anatomies and the biologies and the chemistries that you need to continue with.
Going along with college and all your prereqs, how are you motivated to like stay positive and like go through like college?
So I will say, like, if you do take a sports med path or any medical path that has like clinical hours, or you need to volunteer to get into grad school or those post-secondary or post-college educations, just like thinking towards the future, like if I get this done now, it's going to be so much easier what I do next semester. Like I know my freshman year, I plan to get like all my like Englishes and histories and religions and all that kind of classes and my math out of the way, so I could really focus on athletic training and all those kind of classes, because there's so much little detail. Just the body in general, I'm sure you guys are learning about it, is so in depth and has so many moving parts that I knew if I got those classes out of the way, I could focus on those important classes to get me certified and become the best athletic trainer as I can be. Yeah, just think about the future. I know some parts are going to stink, but just stick with it.
How do you find balance between all of this? Like with your social life and then medicine, how do you do it all?
You have to make time for yourself. Find a hobby, find reading, just sitting and listening, TV. You have to make time, because I know that's a big thing. And I know athletic training talks about work-life balance. And I know a lot of healthcare, especially growing up in residencies and stuff like that, you're so busy and you want to go, but you can only go for so long. You have to refuel your body. So I would say once I get home at night, I'll take a couple phone calls, but if it's past like 9:30, I'm sorry, you're just going to leave a voicemail and I'll get to you in the morning. I mean, there's a time where I just need to be at home and not focus on work, because you do get really burnt out. On practice days, we leave at like 7-ish, but on like nights we have football, we don't leave until midnight, 11:30. But athletic trainers or anybody who's working all day, sometimes the hours can get really long, especially with college. you're working all day, you're on call a lot 24/7. So it is hard to get that work-life balance. And especially as you get older and start wanting to have families and stuff like that, you need to make sure you have time for your family and friends so you can just kind of get your mind off of it so you feel refreshed when you get back the next day.
Now, with the pandemic and COVID-19, how has that impacted your profession?
A good bit, if you say. So I actually finished up grad school. I was finishing up grad school that in March. That was my last semester. So my second half of my second year of grad school, I was all online, which was different for me. I know it's kind of the norm now, but finishing up grad school was very difficult because we were doing a lot of research. So I wanted to go talk to my research chair. And then getting hired. So I thankfully got hired in February, right before it started. But I know a lot of my classmates were having a difficult time getting hired because schools and hospitals weren't really sure kind of how hiring was going to go or if sports were going to get started again. So I know that was a really tough time. And then just because it was so ever changing throughout the summer and we had so many different guidelines. So keeping up with all of that was something new. Face mask was new. I knew it was new to everybody, but the face mask and the N95s and all that was a little bit new. And then the new cleaning protocols. So like making sure we clean the table between each person, trying to keep the social distance in our small facilities. Like we're in a big college, so we don't have 15 treatment tables, so we could eval and treat and spread them out. We got two in each. We have 2 rooms, and we have 2 in each room, so it's kind of difficult. We have a mass amount of kids come in at 340, so it's like, what do we do to spread them out is a lot. So that was definitely a big change. And then the quarantine list, you would think hydration is not a big part of our job, but keeping kids safe is. But this summer, when it was football season, we knew it was going to be 90 to 100 degrees, and we couldn't have our water bottles like we typically do. So trying to figure out how that works for each team and how it works on game day and how it works on practices, that was definitely difficult. So just figuring out what each sport needed so far throughout this COVID process, spacing out the chairs for basketball, making sure the ball's sanitized. Some of the game rules got changed. Like I know some basketball rules got changed to kind of help prevent that. So it's definitely the hardest part is just keeping up with the ever-changing protocols and procedures and how how our county changes it to how GHSA changes it to our company protocols for us to keep us safe. So I think just keeping up with the changing stuff and make sure we're following all the rules, make sure everybody's safe.
Yeah, that's like a lot of things to remember. And I guess, how do you remember so many things? Is it come naturally to you, or do you have to prepare for it?
So I would say with the COVID stuff, it's starting to become a routine, like cleaning the tables, cleaning the water bottles, making sure our interns have their mask on, kind of that kind of stuff, cleaning the balls and stuff. But definitely it takes some work. New stuff I definitely have to, or even if I'm doing a rehab on an ankle sprain or a new injury, I like to write things down. That's kind of how I keep my head straight, especially when 10 athletes are coming to ask you 10 different questions out in a 10-minute span. So I'm definitely a write things down, put it in a calendar kind of girl to keep my head straight.
If you can see on your screen, there's a question that we got asked by a member. Her name is Arush.
Yes.
And she asks, what does a typical workday look like for you?
So my typical workday, as I said, I don't go in until typically, right now, 2 to 2:30, I show up. And we have our seniors that get out around 2 and our virtual kids who are kind of done with the day around 2. So I see them, they come in, either I could do, most of the time it's doing rehab. So rehabbing an injury, strengthening, stretching, using a modality to get them back. Or sometimes kids get hurt that night and they're like, oh, I'll be fine. I don't need to go see her tonight. I'm ready to go home. And they wake up the next morning, they're like, I don't feel good. I'm going to go see her. So I can do evals to kind of see what's going on and kind of plan out our treatment. If we can just do rehab in-house at the school, or if we need to send them out to Northside and get them looked by our orthopedist and her physician assistant. And then game day. So football's a little different. In the fall, it's typically pretty crazy. We do lunch treatments as well. So me and my coworker, we switch off kind of every day, and I get lunch starts at like 11:45. So I get there 11:45-ish and then ends at 2. So doing rehabs and evals during that time. And then 2 o'clock, we typically both got there. Same thing. The people got out, evals and rehab, and then football practice would start. So we would, right before, we would be taping, massaging, doing all kinds of stuff to get our boys out. And then we would sit out at football practice and help with water and any there for those big injuries or anything like that. We can do rehabs on the field if we're like in the functional phase. My typically day ends around 6:37, and then game days, depending on, is much longer. So football game days are done at like 11:30, 12. Basketball usually like 8 or 9. In the spring will probably be the same, 8 or 9-ish is when we'll get to go home on those game days.
Awesome. Yeah, that's like a really long day, honestly.
It is a little crazy.
For sure, for sure.
Okay, we have another question from one of our members, Sanjeevni, and she asked, do you frequently work with a physical therapist?
So in the high school setting, not much. We more work with our orthopedic surgeon and her PA. That's who our main contact is with, and then they kind of reach out to the physical therapist. But when I was in grad school, I was at the University of South Carolina, and they had their physical therapist come in. I think she came in like 2 to 3 times a week to work with like the ACLs and the MCLs and all those surgeries that are coming back, the shoulders and the elbows, those big time rehabs that athletic trainers kind of have. Like, we have a lot of stuff going on, so it's nice for someone to come in and specifically do that. And athletic and physical therapy, we have some of the same schooling as physical therapists, but they have more, and like they have the opportunity to do like dry needling and stuff like that. So I know the athletic trainers in colleges work very close to a physical therapist.
So you keep mentioning like your team. So who does your team consist of?
So our team at Northside, where I'm at now, we have our team doc, who her name is Vonda Wright. She's awesome. And then so our team doc, she's an orthopedic surgeon. We have a physician assistant who works directly with her in the office. And then there's another athletic trainer that works in the clinic setting with that team that we kind of do with scheduling and getting kind of all that info, kind of what the next steps are after we send somebody. Work with her. We have a registered dietitian on hand. And then our athletic director is super important. Ours is awesome at North. He has so much information, getting with the coaches and parents and stuff like that. He's part of our team as well. And we also work with a counselor, working with mental health or anything like that has become a big thing in athletics. And then we also have concussion specialists who we work directly with. So any concussion, we eval in-house, and then typically our next phone call is to him and kind of what the next steps are to get them seen in his office, and he'll do a deeper eval and kind of what their return to play process will be, because everybody's different when it comes to those concussions.
Sanskriti asks, what is the hardest part of your job?
The hardest part of my job would be like relaying bad news. So like an ACL, or they have to sit out, even if it's like an ankle sprain. I'm like, all right, bud, like you got to sit out today and tomorrow. And I, as an athlete, I know how important it is. You want to be at practice, and it's hard relaying that to the coach too. So that would have to be the hardest part of my job, is having to tell someone they have to sit out, even if it is for a couple of days or they're out for 6 to 7 months, like that's very difficult.
Okay, so from Abigail, we have, what made you want to choose this career? I know you kind of talked about like sports, how you're always interested, but like, did you kind of, yeah.
So definitely because I grew up doing sports, and I knew I wanted to be in sports med. I wasn't sure if I wanted to be like a surgeon, because that's kind of like, we had an athletic trainer in high school, but kind of she was just kind of mostly with football. And then like once other sports were going on, we didn't see her that much. So I didn't really know what an athletic trainer was or kind of what it encompassed. So that really wasn't in my head until I got to college. So just like being around sports, and I just love science. I knew that was like, I wasn't a social studies person. I loved biology. I loved anatomy. So that just kind of drove me towards athletic training. It was just like a good combination of all I was interested in. And the athletic trainers are kind of skilled in a bunch of things. So you can specialize. That's a new part of athletic training, is specializing in something, but we're skilled in a bunch of things, which I really enjoyed. Like, I liked being able to help with not just shoulders, or not just nutrition, or not just pharmaceuticals. Like, I like being able to know a little bit about everything.
Snigdha asks, what's your favorite memory of your job?
Oh gosh. Oh my gosh. So just like the big wins, like, I get so into it, and I can't pick out one. Like, I've been with 3 different schools. I've only been with 3 different schools, just 2 in grad school and North Forsyth now. And just those big wins where everybody's excited and you can just like feel the like intensity and just that on the sideline, especially during football. Like, football's got so many highs and lows going on. It's just so intense, and just that feeling, that intensity and that coming together of a team is amazing.
Like the energy on court, right? Yeah.
Yes, exactly. The energy. Yeah, it feels so good, especially when like the whole arena or the whole stadium is like into it with the fans going. Oh, I do miss that about COVID. I want it to go away. I miss like the packed out stadium, the packed out arenas, getting the fans get into it. Oh gosh, it's amazing.
Okay, so Sammy asked, what was the hardest part of your job? Or, okay, you kind of already answered this, but I'll ask another question. Jay asked, during games, are you in some sort of office or on the sidelines?
So during games, we are typically on the sideline or the court. So with football, we have both our athletic trainers are out there, and we also either have our orthopedic doc or our physician assistant out there on the sideline. That's kind of the healthcare team. Sometimes we have our concussion specialist out there as well. So definitely on the sideline during games, either if it's soccer, baseball, basketball, volleyball, softball. One of us tries to get out, but we're definitely both there at football just because it's such a high injury sport and we got a bunch of things going on. During practices, we sit out at football practice the same just because there's so many injuries. During the winter time, we've been in the office. We have 2 athletic training facilities on campus. One is just kind of mainly football. It's not very big. We kind of just go out of there because it's closer to the turf. But we have a really nice one in our new arena that we work out of. So we kind of stay in there because it's a central location. We have wrestling going on and then 2 basketball gyms going on. So it's a nice spot for either people to come to us and there you can find us, or just give us a call and we can get to those in like a minute or 2. For the spring getting started, it's super crazy. We have so many sports going on and winter's still going. So we spend our time from like 2 o'clock to like 4:30. We spend time mostly in our athletic training facility. And then after that, we kind of do like a walk around. So we'll start on our turf and watch women's soccer. And then we'll go to the grass and look at men's soccer, men's lacrosse. And then we'll go to baseball field and kind of hang out there a little bit and then head out to the track. So we kind of try to show our face. If we don't get to everybody in one day, we try to spread it out so everybody can see that we're there. And then typically in the spring, it's best. Every coach has our phone number. If you can't get one, they can call the other. So we can go straight there and we can either walk or jog or run, or we have a gator that kind of gets us there fastest depending on what happened.
Aryan asks, what is the difference in the work in education in what you do and what a physical therapist does? So the differences, yeah.
So the education of a physical therapist, where athletic trainers trying to follow their path almost. So physical therapy just moved to a doctorate. So you finish your undergrad, and I believe you can just start after your undergrad, start 3 years and get your doctorate in physical therapy. I believe that's how it is now. So Like I said, they have a little bit more of an opportunity to go into like dry needling and injections and stuff like that, kind of more of like a breaking the skin kind of stuff. So that's kind of their difference. And they really dive in a little bit more into rehab. So that's kind of there. So after an injury, after a surgery, they're really good post-surgery and kind of what that patient or athlete needs through each stage of rehab. Let's see what else. The work. So they're mainly, physical therapists are mainly just in like one office. Like there's like a physical therapy office or a clinic they work in. And then some, like I said, contract out to the colleges. Like I did in grad school, like she worked with the hospital in their physical therapy clinic. And then she came to South Carolina once or twice a week. So that's kind of where their setting is at. So I don't think they have such a diverse setting. Like they're not in a bunch of 4 or 5 different settings like we can be. So I think that's kind of the big difference in work. But yeah, and education's a little deeper. They do dive a little bit deeper into that rehab modalities and those different kinds of surgeries and stuff. And I think athletic training is trying to get towards that kind of doctorate of athletic training as a common practice.
Okay, so Surya asks, what courses in high school would you recommend to gain knowledge regarding sports medicine? I know you talked a lot about biology, so kind of going along with that.
So you guys are super, like, we did not, I know at North they have the sports med program. I think you guys have like an EMS teacher, an EMT teacher, and Lambert, they have like phlebotomy. We did not have that. So I graduated from North in 2014. So we did not have anything like that when I was going through high school. So I would recommend whatever district you're in or with the academy, going any kind of those healthcare field, if it's nursing, if it's phlebotomy, if it's emergency medicine, all of that, you'll gain great experience heading into sports med, whether you become an athletic trainer, a physical therapist, a PA, all that gives you great experience. And then if your school offers internships, I think those are amazing. I would have loved to do an internship when I was in high school. I know our students, we have a couple interns at North, and our students go back to class and they come to us and they're like, Miss Sydney, Miss Aubrey, look, this is what we learned today. And we saw you guys do that. So I would definitely recommend those. And then, yeah, the biology, your anatomy, your intro to healthcare, stuff like that is really important, especially your anatomy and biology. Those classes will only build and build and build, and there's so much going on with the body. You'll learn something new in each class.
MJ asks, was there a specific case or patient that was the most interesting for you?
There's been a couple. So when I was an undergrad, I got to do an internship, and it was at Wofford College. It's a Division I, kind of a smaller Division I college in Spartanburg, South Carolina. And we had a kid tear his ACL, his LCL, which is on the outside of your knee. This is all hitting his knee. ACL, which is on the inside, his LCL, which is on the outside, his IT band, which goes all the way down your leg and is really hard to tear. He ruptured all of those, and I think he tore his meniscus. So that case was so interesting. It was like one of my first cases that I got to see happen, and then I got to go watch the surgery after. So he did a 2-part surgery, and I got to go watch the doctor repair his LCL, which is a ligament on the outside of your knee, and that IT band as well. So that was super interesting. I loved to be part of all the steps. So I got to see the injury, I got to see the surgery, and then I got to be part of the rehab, which doesn't happen very often when you're part of the full return to play injury to back on the field. So that was I'll never forget that case at all.
Okay, so Sammy asks, is there a medic for each team or one for both?
So if we have one orthopedic surgeon and one PA that covers all of our athletics. So if we have an injury that needs to be seen by a doctor, we send them to them. But athletic training, there's 2 of us on campus, and we both share the wealth. So it doesn't matter what team you're with. If I'm there today and a lacrosse kid comes in and they see me, and then the next day they go see Aubrey, that's perfectly fine. We both have the same amount of education, so we don't really specify teams. It's just kind of who's there and who gets to see them first, or if someone's working with another kid and there's an injury happens on the turf, whatever one's available to go out there. So we don't really put each other with each team. But in colleges, they typically do have an athletic trainer per team or per two teams, kind of. In like the D1 setting, it's typically just one per team. Sometimes they work two, so like a fall and a spring sport. But I know in the Division II setting where I went to school, typically each athletic trainer had two sports, either a fall and a spring or like a winter and a spring or something like that. Just kind of shared because we have something going on all season, but definitely at those D1 big top 5 football programs, you have like 3 or 4 athletic trainers just for football. So just kind of depends on what setting you're in.
Now, this one's a bit of a risky question. It's from Sanskruti. She says, have you ever experienced a weird situation where you didn't know what to exactly do?
Oh, of course. Like I will be honest with you. I'm a new grad. I just graduated in 2020, May of 2020 with my graduate degree. So I do know a good bit, but I'm always learning. I go back to my books all the time. Doesn't matter if it's like an injury and I'm like, I think it's this, but let me go look at my anatomy real quick just to make sure I'm in the right spot. Or if it's rehab, so much I go back to my rehab book. I'm like, what phases do I need to be in? So he just 2 or 3 days out. So what do I need to be working on? Just range of motion, or what can he work on? Yes, I always go back to my book, ask questions. Our physician assistant who's at Northside, we reach out to him all the time. Like, Deep, we have this question. It's kind of something we haven't seen before. Do you have any advice? So yes, always learning. As athletic trainers, we have these things called CEUs, which are called continuing education units, credits kind of thing. So we have to get 50 of those, 50 of those, and they're kind of split up into different categories. But so I try to do either, like when I split mine up, I try to do like a modalities one. So like learning new like scraping techniques or Graston or cupping or something like that. That I can bring back to my school, or even just like new injuries that don't happen often, but you do see them. So like making sure like we have the best care for like if an athlete has a C-spine injury, or best concussion care and stuff like that. So definitely some situations where I definitely go back to my textbook or go back to my mentors and kind of get them to help me out.
Awesome. It's like really interesting in how healthcare, like you're always like learning something as a healthcare profession. Yeah. There's no such thing as like knowing it all.
No, like science is always changing. They always come out with new and better things. So like even if it is like something simple like ice, like should I ice now or should I ice later? Like there's so many studies done on that. Yeah, definitely if you're in the healthcare field, keep up learning. You don't want to get behind on anything, new techniques or nothing like that. Definitely an always improving, always advancing kind of career.
Right, especially with new innovations and like new inventions that are coming in. It's always
exactly.
I totally agree.
Yeah.
Mystery asks, what is the most common injury that you see?
I would say ankle sprains. Ankle sprains happen in every sport, and it's so easy to do. Those are definitely the most common injuries we're seeing right now for sure.
Awesome. If I ask, how do you manage multiple athletes being injured at the same time?
So if it's just me by myself and two athletes go down at the same time, you go to the one who is the worst injured, the one who you think if it's life-threatening, you go to them. If it's about the same injury and they're like, okay, and they can sit there, you still go to the worst injured one, just if it's like 2 ankle sprains at the same time. You kind of go to the one who needs the most help at that second.
Oh, to give you a little background, this is Coach Mar, and she's our EMS teacher in Alliance Academy. And she says, so what you're saying is that the classes we teach are relevant, and it's good to retain the information we're teaching them?
Yes, exactly. any of the stuff you're learning now, it will only grow. You will learn the basis now to get good base knowledge, and then you will go back to that knowledge. I still go back to my college anatomy 101 class all the time. So yeah, definitely pay attention now. It'll be relevant in any healthcare field you go into.
Yeah, like going back to that, like I just think it's so cool. Like personally, like part of HOSA, I'm doing a competition cert, and it like has a lot of the stuff that you're trained to do, like being able to like respond to like injuries and like differentiating between immediate and minor injuries and like DCAP, BTLS, kind of just knowing.
That's awesome.
So it's like really cool how everything just comes full circle.
Mm-hmm.
And then Alina asks, is there a job related to this / does this job involve traveling to certain places? If so, what is the most interesting place you have been?
So I would say, like in athletic training, probably the setting, the job setting that kind of travels the most, I would say like performing arts. Like you can work for Cirque du Soleil, so like they're traveling all over the world. And then within athletics, I would say working with a college team, because you'll travel to different states and sometimes out of state, out of country, out of the U.S. So definitely, depending on the job setting, where you're at, you'll definitely travel more. Like in the high school setting, we don't travel that much. We kind of stay within the county, or my last couple of schools within an hour or two of each other is kind of the farthest we went. The most interesting place I've been as an athletic trainer. So when I went with Wofford, I worked with just football. So we traveled, they're in the Southern Conference. So our last game was played in North Dakota. So not that it's super interesting in North Dakota, but it was a really cool experience so we all flew together. So packing the plane, making sure we had all the stuff we needed before we got on. Our bags had to weigh a certain amount because we had football players with football equipment and all kinds of medical equipment. And then unpacking the plane when we got there and kind of setting up in a new territory that we haven't been to, and flying on a plane as a sports med team is something I'd never done before. So I was super excited about that. And then, so it's not very far from Wofford, but Charleston, we went to Charleston for a game, and we kind of we got there the night before. So we kind of got to go out and kind of eat at different restaurants and kind of tour just a little bit of what Charleston has to offer, the little bit we were there. So those are some of the cool places I've been as an athletic trainer. Those are mostly as students, but definitely cool and interesting, even though they weren't very far. Our North Dakota was far, but even though Charleston was far, I still had a great time. It's high stress and not a lot of sleep, but you'll love it the next day.
So we don't have any more member questions, but I have one last question. What was your favorite? No, it's not bad or anything. What was your favorite college or graduation memory that you have?
I so hate that I missed out on my graduate school. I heard that was going to be awesome. We were going to get these fancy hoods, and they were like, it's so intimate. So I missed out on that. But so like my graduation, like the actual ceremony and all that. Is that what you're asking about? Okay. So my Limestone graduation, my cohort, we started out with like 15, and then I think we were out down to like 8 or 9-ish by our senior year. We did like a big photo shoot before we graduated, and it was hilarious. Like we acted out like different scenes, like someone was calling EMS, someone was on the ground, like someone was holding C-spine, like someone was like clearing the scene, like all the things you learn in CPR, and it was amazing. And then, so to be an athletic trainer, you have to pass a certification exam. So I took it like March of my senior year, and my results came back in May. And I just remember like reading that email was like one of the most exciting things. And then like I took my best friend, we took it together. Like we went to Charlotte and took the exam sitting right next to each other. And so like calling her, I was on the road with softball. So like calling her and talking about it. And then we got home, and we like took pictures with our little screens. So just like that whole certification process and all of my hard work and studying, like coming down to one moment and passing that exam and getting to like just relax with the rest of my cohort was amazing. That was probably one of my favorite parts.
Yeah, it's like all the stress finally pays off.
Exactly. It's like a good relief for a couple days, and then you're like, all right, got to go back to school.
That's really cool and probably like such a good memory for you.
It was amazing.
Yeah.
And we have another question from Coach, and she asked, "Can you explain how the concussion protocol works?"
Definitely. So here at Northside, as soon as like a concussion happens, before the team start, we try to get them before they start practicing, but definitely before they start playing, we do an impact baseline test, which is like an online computerized concussion test that kind of gives us a baseline on their reaction time and stuff like that, so we can compare it. So we take that before, and then say an athlete gets a concussion, we do a SCAT-5 on them. I don't know if you guys have gone through that, but it's just like a quick concussion assessment with orientation, concentration, a bunch of different questions. Saying your months backwards. Can you remember these words? Can you remember these numbers? That kind of thing. And then if it's a suspected concussion, we pull them out immediately. How to play no games with the brain. If you have a headache, dizziness after a big hit, don't care if it's a 1 or a 2, you're going to come out and sit with me at least the rest of the day. So after that, we do that eval. If it's late, immediate text or a call to he's an athletic trainer that actually works directly with our concussion specialist. So-and-so has a concussion. Here are symptoms. They can either be from just has a headache, dizziness, kind of sensitivity to light, or it can be he's throwing up, he can't really sit up straight, he's kind of spaced out kind of thing, kind of let them know a little quick synopsis of what's going on. They'll go to the concussion specialist either the next day or the day after and kind of get evaled by him. They'll retake their impact test there to see how off they are on their baseline and kind of the areas we need to work on. And then we get a call back from the concussion specialist saying we can start protocol or let's work on his eyes. His eyes aren't tracking correctly. Let's kind of get those handled and then we'll start it. So our protocol is 6 days. So day 1 is just like walking or biking for 10 minutes. So we do a symptom check before they start and then after. And if in between they're like, my headache's it goes to 6. So my headache's at like a 4 or 5, Miss Sydney, I can't go any longer. I'm like, okay, that's fine. We'll stop for the rest of the day and then try day 1 again tomorrow. So, and day 2 is just an increase. So a little bit of jogging, some push-ups, some sit-ups, kind of get that head motion going, but no twisting and turning, lunges, kind of get that heart rate up. And then day 3, we start back into some sports specific activity. So with our running now, we're going to jog with the basketball, or we're just going to do some spot shooting or football. We're just going to run a few routes with no ball. So that kind of thing. And then day 4, we do full, a lot of activities. So like throwing the ball, catching the ball, still trying to stay out of the no contact range on day 4. But still trying to get them back into condition, especially depending how long they've been out. And then day 5, we do a full practice. If it's football, put pads on, you're going to hit somebody. And then day 6 is full clearance. So if somebody say we're in day 3 and we're doing sprints and karaoke and agilities, and they're like, Miss Sydney, I can't do it. My headache and my dizziness, or I'm about to throw up. We stop that day again, and we don't go back to day 1. We just kind of stop that day, tell us what they were at. Like, all right, we'll be done today. And then the next day we come back, we still stay at day 3 again. So we just kind of stay at that day until they're like, all right, I have no symptoms now. I feel good to move on. And then before we clear them to fully go back and play, we either have just a conversation with our concussion specialist, depending on the athlete. He feels great. We've had no problems. He did day 1 through 5, no issues. Or if we're like, I kind of got stopped on day 3, had to do day 4 twice, but he felt fine on day 5. He might see him back in the office, just do another impact or check on his vestibular or anything like that, kind of check him out before we return them back to full play. Hope that answers your question. They just have to get a physician. They have to see a physician before we clear them to go back.
Okay, excellent. That ends our Q&A for the night. First off, I'd like to thank you so much, Ms. Turner, for your time. You have definitely inspired a lot of our Alliance students tonight to pursue sports medicine and continue our passion in healthcare. Thank you so much. And also thank you so much for speaking to all of us, all the AI HOSA members. To close out our event, we'd like to thank all of you for joining this conversation virtually and making it super interactive with some brilliant questions. Thank you guys.
Yes, thank you so much, Ms. Turner. And for our AAI students, we're going to leave the QR code for attendance up for 30 seconds. And then this video will be posted soon on our YouTube channel. This form will close on Monday, January 25th. So be sure to fill out by then. Thank you so much, guys. And
Awesome. Thank you.
Thank you.
Thank you.